Could it be argued that Boris Johnson is one of the bravest politicians in the UK for finally tackling social care? No, it could not be argued. Welcome to the Lib Dem Podcast. Hello, everyone. Thank you very much for tuning in. Before I introduce our wonderful panelist, who is, of course, Richard Kemp, we will just give a quick reminder to hit that like button. Make sure you subscribe to the podcast and do let people know about it. Let other Lib Dems know about it, about how they can get involved. They can comment. They can come up with episode ideas. We'd love to get more of you listening to the show. But today, we're going to talk about social care. And Richard, you were the LGA lead for social health and social care for 6 years. So last week's announcement, were you impressed, not impressed, didn't give a monkeys? What were your thoughts?
Well, I'm still a bit staggered by your introduction about Boris Johnson and how to be polite in this ensuing discussion. So let's be absolutely clear, first of all, what last week's announcement wasn't. It wasn't anything to deal effectively with the reform of health and social care. If it was anything, and there are some good elements of what he's moved, it was stuff to deal with the financing of healthcare and then possibly social care at some time in the future, but I don't think we'll get it. So what he proposed, basically, you could say, was partly out of the Lib Dem manifesto, not out of his manifesto, but out of ours. Because, of course, we've been arguing, particularly in the 2017 manifesto, for a 1% tax increase for health and social care.
But income tax, not NI.
Well, that's true. And that's why it's only partly what we want. He has improved what would just be an NI increase, for example, by charging NI to people over 65 now who didn't qualify, and for making an investment tax. So that NI in that context carries over into people who get a lot of their income from, for example, shares. So it isn't just NI, it is NI plus. But the idea appears to be, and I'm being vague because Parliament have voted on something which is extremely vague, that this will become a tax on income at 1.25%. Which is actually more generous than the 1% that we were asking for. Yeah. But we don't know that yet. And there are many things that could go wrong as it moves into a full tax position, and that will make it a lot better. But we have to ask why we're doing it at all. Far be it from me as Remainer, John, to say all this is unnecessary, because there was 350 million a week coming in, which is far more than being claimed. All we had to do was leave the EU, there'd be shed loads of money. So why do we need it in EU terms? And why do we need it anyway? Because the amount would be dwarfed by us dealing effectively with the people like Uber, KFC, McDonald's, who take vast profits out of this country by declaring a sort of service fee and take their money to other administrations. So it doesn't deal with the gross amount that's required in the right way, in our view.
And a couple of little kind of clarifications is probably, so where it has gone up 1.25 percentage points, let's not confuse that, because it is actually a 10% increase in NI. That's how you work. So you do get some people who got very confused by that. And I said, well, obviously, if you go from 10 to 11, that's a 10% increase. So it sounds very small when you're talking percentage points, but actually, if you were getting a bill and it had gone up by 10%, that's quite a painful hit.
Or to put it another way, it's £200 a head for the people on the average income.
Yeah, that's right. And then one thing is that councils and the NHS will not be paying this in terms of they are going to get additional funds to offset that. That's what the government has said, because there was a lot of kind of argument. Well, yeah, you're telling you've put up NI to pay for social care and health, and they're not, but those are exactly the areas, the councils and the NHS and the hospitals are going to have to pay extra NI, so they're not going to make the benefit. So the government has now given them additional funding.
Yeah.
But you were right to point out, I mean, obviously, I'd say in 2017, when I was standing as general election candidate, that penny on income tax was actually very popular. I would say, because I remember being in hustings with people like with the Defence Secretary, Ben Wallace, saying things like, you can't get it for free. You know, you want world-class modern healthcare system and social care system, you have to pay for it. And people kind of got that. And I think that was reflected a little bit in the polling straight after Johnson and the government announced it, that people were like kind of, yeah, it was split. It was almost a 50-50 split, actually. People saying, yes, we completely understand. What's come out, obviously, is the nature of it in terms of the NI, whereas, you know, there's lots of exemptions to NI, like people who have unearned wealth, people who have, say, if you own property, you don't pay any NI on that, whereas the worker that lives in that property does. So question for you, Richard, were the Lib Dems right to vote against?
Yes, they were. Firstly, we should be finding the money without more taxation on individuals. There's plenty of places you could get it from. Secondly, this is an incompetent way to deal with it. It's not as incompetent as it might have been, because as you say, they've made a series of concessions, which I strongly suspect they didn't want to until they realised what they've been talking about. And the Lib Dems were right to vote against this, because it's voting, if they voted for it, it would be suggesting that this was a competent plan to deal with health and social care. And it is nowhere near that. Now, even if we only look at the financial implications of this, it is highly unlikely that local government who deals with social care will get much money for at least the next 3 financial years.
And so it was really interesting the day or maybe 2 days afterwards, I think it was the Times saying about council tax will be urged to council will be urged to put up council tax significantly, which is what they've done in previous years, as we know, as upper tier authority councillors, where they've said, well, the government will say, we've put in X amount of millions into social care. So no, you haven't. You've allowed councils to raise council tax by that. So you haven't done it in that way. You've just allowed councils to charge more to their residents. Yeah.
And of course, very few councils will be putting up their council tax next year, because they've already taken the 3% for 2 years in the current budget that we've got. Now, the effect of not putting money into social care now is actually to put more pressure on the health service. And I'm surprised that the Tories don't realise this. Just ignoring the fact that social care in people's homes, in the community, is a lot better for people. It's a lot cheaper as well.
Yeah.
Keeping someone in their own home, for most people, there are some that this with really acute problems where this doesn't apply, but for most people, keeping them as fit as possible for as long as possible means that there's less pressure on the health service. And the health service general bed is now approaching £600 a night. Decent social care might be £600 a week, if that. So they're actually spending the money wrongly. And of course, that's what goes wrong when you look at the whole healthcare, social care continuum. Unless you spend the money on the right things, you're only staving off a crisis. And I think if you look at the figures, that in 5 years' time, someone will be coming and saying, oh, we do have a health tax now at 1.25%. Let's nudge it up by 0.5% or a bit more. And if we have to pay it, Lib Dems believe you should pay it. But the basic point is, we don't believe you should be in that position, because you should be stopping people becoming ill and in need for as long as you can.
Hello, John from the Lib Dem Podcast here. We are delighted to say that this episode is sponsored by Prater Rains. Now more than ever, you need a professional-looking online presence and website. Prater Rains have been helping Liberal Democrat campaigns succeed for 18 years. Their Lib Dem Foci package combines a website, social media and email system to help Lib Dems win. You'll receive great support from real people, fair pricing and a huge range of features to choose from. Prater Rains are already the bespoke developers for Lighthouse, Lib Dem Draw Online and the LD Directory. They combine a talented system design with an unrivaled understanding of our party, our data and our systems. To find out more, check out the Praetorians website at praetorians.co.uk/liberal-democrats. You alluded to it right at the start that, I mean, I'm of the same opinion as you. I don't think any of this will actually get to social care at all. And like you said, we see it all. Short-term fixes never actually pan out on a long-term financial scale. Like you say, like cutting youth offending budgets was another one that's happened in my area. You might think, oh, that's a short-term fix, but then the cost of that implementation, if crime goes up, etc., far outsees that. And it's the exact same with social care. It's really short-sighted.
Yeah, and in fact, we've had 2 debacles at general elections about this. The last one, of course, was about the dementia tax, which was very similar. I can't think what it was called, but in 2010. So that was an attack by Labour on the Tories. The Tories attacked Labour by coming up with very similar proposals in 2010. Now, the fact is that no one wants to pay more tax. So you can always use this as an excuse, because unless you've got someone who is in your family who's a dementia patient or getting frailer and frailer and frailer, you don't really think of the implications of this. And then it hits you when you have to sell your house, when you have to start making arrangements for your mum or dad who've always been looking after you for the first 80 years, and now you're having to become their mum and dad in a different way.
Because it was very obvious the Tories didn't want to make that pledge that would it, because I think their manifesto was no one would have to sell their house for social care. And they were asked repeatedly by journalists, and not one of them gave a straight answer on it. Because, like, again, we said that the £80,000 cap, is it right? Something like that they've put on. That is literally just the care costs, not if that person's had to go into accommodation as well. So, I mean, I live in a £160,000 house, so I'm probably in like the worst bracket in terms of when they showed the financial things that those at the very richest have the least effect by this, and that's the kind of the way they worked out. You know, the how many assets you have compared to how much you'd pay. But but there's going to be lots of people in houses roughly around mine kind of price range that I just think, well, there's no way. Who has £80,000 in their bank account spare anyway without selling their house?
Very few people, or they'd have to cash in pensions or other things to make it work. When it comes down to the principle, though, I think it is worth discussing whether or not houses should be sold anyway. So 2 issues here. One is, should there be a cap? And of course, Andrew Dilnot's original proposal, which has only been updated for inflation, came about because Paul Burstow, who's the Minister of Health, called it. And I think that's right. So I'm in a position, if that cap is fully confirmed, to now say I have got a little bit of spare money, as it happens, if Erica finishes decorating the house the way she wants. And I can now say, well, I can probably release a bit to my grandchildren or my children. But as a principle, I worked all my life, as did my wife, and we were lucky enough to save money. And we saved money for our use. We helped the kids. They're now sort of 40-ish. They're old enough to stand on their own 2 feet. And if this house has to get sold to pay for our care, I must say, Erica and I we're not really bothered about that. Neither are our kids. Our kids have had a good start in life. We paid for that. We helped them. Now, the money we earned should be helping us. So I think we do need to have a discussion because the old saying is, isn't there, where there's a will, there's relations. And most people, when you look at their house price, this house I'm in now is quintupled in price since we bought it. Now, part of that is the fact we've improved it, but part of it, there's been house price inflation. I didn't earn the money for this house. It almost earned itself.
and that's why, I mean, Lib Dem policy on, say, things like land value tax and stuff like that is one which would be, a lot of people said, would be far fairer. And again, deal with it, because at some point we're going to have to, this country is going to have to not tax just on earnings. And that's one, because now I think, actually, and you can see things like the Telegraph very come out strongly. I think this is the highest rate of tax since the Second World War we are now currently at. But that can't go. And remember all the talk during, I think it might have been the back end of the Labour government about non-doms and people like that who live very well in Britain but pay nothing towards British coffers at all. And these are the kind of things, and lots of people talk about, and Labour talking, particularly the left wing of Labour, talking about wealth taxes, which is right, but you're never going to get as much from, say, the Amazons and Apples that you want. Everyone says it. We say it. Everyone says it. It says we need to tax the big corporations. You know, big corporations are very skilled at getting away from paying tax. So you've got to think, okay, how can we move the dial a little bit there, but also a little bit in other directions as well?
Yeah, but there are other ways of doing that. So, for example, if you compare the tax, the rate tax for a big company like Amazon per square foot, and compare it with a shop. So one of the things you can do, it's very difficult to deal with international transfers of money, although the Biden administration is trying to do something. Yeah. But if we said that those people who have distributing warehouses should pay a higher rate of tax, that's the tax on land, or tax on land and buildings, which we can take advantage of. And that would reduce the amount of money that they could transfer.
And it would also help, because we've seen a big change, obviously, in retail in terms of high street versus. So, and we, you know, everyone knows that distribution centres are now huge. They've very much taken over. So a lot of the workers that would have maybe been in retail and city and town centres have gone into distribution services. So actually what you're saying is absolutely right. That is a shift that might need to happen.
Yeah, and it goes for that reason as well as a taxation reason. But if we go back to the idea of what good health and social care reform would look like, there are a number of facets which are being ignored by the government. The first is who controls it at a local level. And the government are currently trying to introduce a new inspection regime for local authorities and the people that we fund. At the moment, it is done by CQC, Care Quality Commission, with a fairly wide remit, and that will be honed in much more. But the fact is that we saw during the pandemic that some actions are far better taken locally. And that is by people, the councillors and the people we appoint, who know our patch well, and know what works, know where it works, and know how it works. I mean, the biggest problem facing the provision of residential social care at the moment is there are still a lot of very small units. And we really accept now, if you want to get nursing and other facilities in, you need 80 to 85 rooms. It's not something I like the sound of. Wouldn't you like to live somewhere small? Well, I would, but I'd also like someone if I needed to have a nurse on tap. So you've got to make some payoffs. And then the other problem we've got, which hasn't been addressed by the government at all, is getting people in. I mean, social care is 100,000 people short. People can leave minimum wage and social care, do some quite distressing work, and go and work at Amazon or Tesco's for about 30% more per hour in more congenial circumstances. So we haven't addressed those. And the only way you can do that is by a local authority really looking at that provision. Then the other thing that the local authority can do is to really bring together the domiciliary care, the care in people's homes, to make sure that that fits in with disabled facilities grants, to make sure that that fits in with the primary care network, to make sure that that fits in with proper work with the acute hospitals, because old people do have to go into hospital sometimes. Often they stay there because they can't get out again. So making that system work is never going to be done by the DOH in Victoria Street. It needs local control to manage the chain of people who are fairly healthy at, should we choose a nominal date of 68, but over the next few years will inevitably decline. The other thing that there needs to be much more localization of now is children's health and social care. We have huge problems now with children's mental health. We had them before the pandemic, they've got worse. Who but local decision makers can look at the special school needs, relate that to provision in ordinary schools, can relate that to specialist mental health care, can make sure that those people who are severely physically and mentally disabled don't face a gap as they move to adulthood, because often they drop out of the system at 17 and a quarter. As one lot of people said, oh, they're going soon, and don't get picked up for a year and a half when the adult providers pick them up. So that needs a proper local continuum, and the government hasn't addressed that at all.
One of the big issues is going to be about staffing. And, we can't get away from the fact that vast numbers of staff in the care sector came from Eastern Europe and European colleagues, and they've gone home. We're seeing it. All the effects of Brexit are now becoming very evident. I mean, coronavirus was a strange time because it kind of masked some of the first effects of Brexit, but now these are properly coming through. You're seeing it with the lorry driver shortages, and particularly in the care sector as well. So I do wonder, to deal with staffing, which obviously the government plan had no plan for how to deal with staffing, how to give them a better pay, is whether we do need to add some sort of national pay scale for care providers like they do in the NHS. I mean, it's very difficult because care providers can be private, etc. as well. But actually, if you say there is a national standard that you have to meet and it has to be so much and there's got to be various bands or whatever, that would be a way of not only getting people into the job, but giving it the respect it deserves. Because like you said, carers have never really been paid properly. And given the work they do and how important that work is, we're not doing enough.
Yeah, well, the first thing we've got to do is to recognise that these are not unskilled workers, because they can't come in from other countries because they're unskilled. Well, I tell you what, I haven't got the skills to deal with a severely disabled elderly person with dementia and probably physical problems as well. I just haven't got it. So these are skilled people. So I think you're right. We need to do two things. Skilled people need properly rewarding, and whether it's the living wage or the minimum wage doesn't matter. It's still inadequate.
Yeah.
And the second thing is we have to help professionalize them in standard terms and increase the flexibility between the care sector and the health sector, because at the moment it's all one way. One of the biggest drains on the social care sector is people going straight to the NHS and getting 15 to 20% more for basically doing the same job. And again, that's counterproductive, because unless we can keep people in the care homes, as we discussed before, there's stress on the health service. So all this has been missed by the government. The idea that there was an oven-ready plan is as bogus for this as it is for anything else. And it is absolutely right that people like you and I, who are Remainers, continue to point out that one of the big consequences of Brexit is a diminished health and social care sector, both monetarily and in terms of staff.
And I wonder what the political fallout will be, because it's interesting. I talked about the polls directly after this, which were kind of split, but then the government has taken a fairly sizable hit to their popularity over this last week or so. Do we think this is just, chickens coming home to roost a little bit with the government, not just the incompetence and everything else that goes on, but actually we always knew there was, whatever happened with coronavirus, there was going to be a bill to pay, and the bill is now being paid. Although with this particular issue, I should point out that you were right when he said he had a plan for social care ready to go when he came into power in 2019. We never saw it. So again, I do wonder if they're using coronavirus a little bit to offset this. This was a decision they were always going to have to make, and they've kind of bungled it. People realise that NI isn't the right way of doing it. Do we think that the government, that we've hit the high mark of the Johnson era and it's only downhill as reality bites?
God willing, but I don't know. I mean, basically, as you pointed out, the key difference between the Lib Dem position and the Tory position and the Labour position, which didn't actually exist at the last general election, is that we were open and honest about it. We said this had to happen, and we can defend it. I haven't seen anyone in our party saying that that principle is wrong, and that our Lib Dems MPs were wrong to oppose it because of the wider considerations. But it's very indefensible for a Tory. Basically, they lied.
Yeah.
They lied or didn't understand, and given the current state of the Tory party, I'm assuming it's lying. So I think it's very hard for me to detect a movement in Tories in Liverpool because there aren't enough to find. But I get the general feeling that that Brexit, the response to the coronavirus, which has largely been very poor, although the vaccination program was good, 33 billion spent on a track and trace, which they're now admitting wasn't useless, 20 million on an app that didn't work. Even the app that didn't work very well, because being an old bloke, I've got a very old phone. I couldn't get the app on mine, so I still had to resort to paper. I just think things are trickling away now, and governments become more unpopular over a period of time because people always remember the things they didn't like rather than the things they did like.
So the government has said they are going to come up, well, Sajid Javid has said that he is going to come up with an integrated plan for health and social care, because that was part of the thing. What we had the other day, last week, was actually just a tax plan. It was just a fiscal plan to do it. Actually, all the things we talk about, some of the problems we have and actually if you listen to some of the stuff Johnson was saying, you can't fix health without fixing social care. That all that was absolutely right, completely right. And I ended up thinking that, I could have said that, what he said, but there's no plan for that yet. And I think
you would have meant it, John.
That's the difference. But so what we've got coming up in the next months, although who knows when they'll actually do it, what would we like to see from an integrated kind of social care and health plan in the autumn if it comes?
Yeah. Well, first of all, I'm skeptical about it coming forward in any realistic sense. I became the spokesperson at the LGA on the 1st of September 2015, and my first meeting was going to meet DOH officials about the green or white paper on social care. On the 31st of August this year, when I left, we still hadn't had it. And there have been numerous opportunities since then. The local government association has issued white papers, green papers, consultation papers. So we're very clear at local government level, and this is all of us in local government, not just the Lib Dems, that you do need an integrated care plan, that until you've got that, you don't know what money you need and you don't know where to spend it. So we've certainly put the cart before the horse in this case. So what would we want? Well, we'd want a recognition of, firstly, that this is a long-term problem, partly because the biggest pressure on the system at the moment isn't the elderly, it is the people who would otherwise have died either at birth or very shortly afterwards, who can now probably live till they're 60, but might need 300,000 a year spending on them if we're to give them any dignity of life. That isn't being picked up by these proposals at all. And that will just mean more tax. I can't leave these people won't be leaving their house for it because they'll never have one. So we need to recognize the long-term nature of this. And the long-term nature of the fact is that we are an aging population. Now, there's strong suspicions now that won't increase much because there is a natural body life. But more people, because they live in better houses and warmer houses and eating better food, will live to become old. And that creates its own problems because if we're all old, where are the young people going to be who'll pay the tax and who will look after us? So real problems there in understanding the continuum. But there's still the process that we don't spend the money up front on prevention. So I'd like to see the Liberal Democrats come up with a very bold statement, but we'd have to be very careful how we said it. We want to close hospitals and hospital wards. because 30% of the people in them shouldn't be there.
Mm.
They are people who are obese with non-clinical obesity, but cultural obesity. And that causes 14 different problems, starting in many cases from the age of 11. 10% of the people, at least in hospitals, are there because of drink and drugs problems. We should be tackling those, but we've cut the money for drugs action teams and alcohol reduction teams. And at least 10% of the hospital population are people who should be back in their own home or somewhere in the community that's cheaper and better. Now, if we were to start now, and those figures won't swap immediately, turn around immediately, but unless we start that process off, we're always going to have crises. But it was very interesting that, if you remember, when we stopped smoking in public places, the people who deal with these problems in hospital noticed in about 6 months a slight change. So yes, it will take years to take full effect for some of the things we're talking about, but some of it will happen very quickly, and that saved lives and people saved, able to go out for a walk instead of having to drag an oxygen cylinder around with them. So we want to see that. And then, as I've alluded to before, to understand and deal with that continuum up there, and then local decision making to bring about the local changes that are needed, which can't be enforced by anyone in Westminster or Whitehall.
Yeah, well, I think, Richard, we've kind of covered that, and as we've said, it's kind of like we'll wait and see what happens now, really, because what's going to happen with councils, what's going to happen with the integration of it. The government's almost just pressed hold. They've put enough money that the NHS isn't going to collapse over the next couple of years. That's right. And it is kind of, and because it just shows you how much the NHS needed that money. But then are they really going to say in 3 years' time, actually, NHS, we're going to take that off you? I don't see that politically happening either.
No, but there are some things that Lib Dem councillors and Lib Dem campaigners could be doing now. Perhaps we could close on that, because we've been talking about policy. So I would say to any Lib Dem health spokesperson on the council, I'd be putting questions down now about how many vacancies there are in adult social care, how many job vacancies there are in both adult social care and residential care, how many people are in hospitals who don't need to be there with delayed transfer back into the community. There's a series of questions that I think Lib Dem should be asking to then inform a proper policy debate inside their area, and possibly a proper campaigning system as well. Yeah. So don't think, oh, nothing we can do about it. We have to leave it to our MPs and whatever. There are things that each and every one of us could be doing, particularly if we're councillors now, to challenge what's happening in our communities.
And I can't think of a better way of ending that, Richard. So thank you so much. It's been nice, just the two of us again, Richard. It feels like the good old years of 2019, before all this nonsense happened. Yeah. But thank you to everyone who's watched and listened to this podcast. As always, you can follow the Lib Dem Podcast at Lib Dem Pod. Make sure you subscribe to us wherever you get your podcast. Make sure you like us on Facebook and on YouTube. Make sure you give Richard some appreciation at Councillor Kemp. He is always our favourite panelist on the podcast.
Oh, you're so nice. What do you want?
What do I want? Yeah, you can tell I need a favour. No, but thank you so much, Richard. And no doubt we will come back to this, because it's not going anywhere, this issue. And any updates, me and Richard will be back, maybe with some of the others if they behave themselves, doing another episode on this really important topic. But if you've got any comments, I mean, I've actually loved those questions that Richard's just put forward. Will you use them to put to your council? Remember, even if you're not a councillor, most councils allow public questions. Go and write those questions in and put them on the spot. Force them to have to think about it. So thank you very much for listening. We'll be back with another episode very soon, and thank you very much.